speaker is an international speaker. Now I invite Dr. Susan MacDonald from USA, and her topic is SICS in zonular dialysis. Madam, can you share your screen?
Yeah. I am doing that right now, gentlemen. And let's see. Am I sharing?
Yes, ma'am. Yes.
Okay, thank you. I'm delighted to be here. It is a huge honor for me to be invited with amongst so many amazing surgeons and a country that is filled with so much knowledge about cataract surgery, and especially small incision cataract surgery. This group is amazing. I want to thank the people that invited me to participate. And I don't know what, okay, let's see. And specifically, I want to thank Dr. Sahu and Dr. Megar for their generosity and kindness. Now, with zonular issues, we need to remember that confidence comes from being prepared. That means that we need to think about the complexity of having a weak zonules and a zonular dehiscence before we get into the operating room. This is something that is critical for us to anticipate and share this knowledge with our team. I don't know why my video, okay. And if you don't prepare yourself knowing how to place a capsular tension ring or how to prepare as far as having an Ahmed segment placed in, it's best to avoid this surgery. In other words, you need to learn this skill set, period. I don't know why it is not moving. Here we go. Okay. All right. So as you see in this particular case, I have a patient here who has a zonular dehiscence from about 12 o'clock until 6 o'clock. Prepared I was, because I decided I was going to use trypan blue so I would have excellent visualization. The next thing I did is I used a very dense viscoelastic Helon 5, and we placed that into the eye so that we had a controlled anterior segment. Once this was completed, the next most important piece of advice I can give to everyone is make sure your capsulorhexis is large and generous so that you're able to push and bring up the nucleus into the anterior chamber. My videos are getting stuck, so I want to just say I'm sorry about that, but I'm going to move it manually. Here I am using Utrata forceps, and I am actually creating a nice capsulorhexis. If you see, I am using the area that has good zonules to start my capsulorhexis. The next is we want a very large capsulorhexis. I'm just making that point again, showing you here is a beautiful capsulorhexis, and it's made easy because I have the trypan blue and I have an excellent skill set of doing a capsulorhexis. The next important piece is a generous hydrodissection. And you'll see in this particular case, I'm able to move the nucleus around very easily without any attachments. And so I'm very confident that I have hydrodissected properly. The next point, if you need a CTR, if you think it, you need it. And so having this skill set, this is Dr. Megar showing us putting in a capsular tension ring. And this is quite excellent. Finally, I believe SICS is the surgery of choice for these particular cases, using a double dialer technique of having one dialer below and one above is the way to go. Remember, you need to stabilize the capsule or stabilize the bag. So it's important to have different techniques. This is the Yamani technique that I like to use. I have that in case I need it, which gives me more confidence. I want to thank every one of you, and I want to thank my mentor, Alan Crandall, who gave me this skill set I have.